Liposuction, implants, or regardless of the procedure, it's important to choose wisely when selecting a plastic surgeon. How do you look for the right person? Dr. Greg Ratliff explains the best steps to take.
Well, we're at the Plastic Surgery Center of Tulsa talking to Dr. Greg Ratliff about breast augmentations. And we talked to you about this once before, but now we're really going to get into the nitty-gritty of it all. Why would somebody want to get a breast augmentation? What do you see?
Two reasons. The main reason is after kids. Breasts have a tendency to swell, then the breast tissue goes away, but the skin stays the same, so there's less volume, and it could be even less than before babies. So people just want back what they had before. The second person is the person that the breast fairy never came by. Unfortunately, clothing, women's clothing, is designed to fit around kind of a C-cut breast. And so if you don't have something close to that, it's either hard to find something that will not just sag and bag and look bad, or something that's just too tight. So those are the two main groups.
Okay, what about, like breast cancer? That's definitely...
Breast cancer is one of the things that we screen for before we do an augmentation. If there's a family history of breast cancer, then it's better to put the implants behind the muscle because the mammograms are easier to do. But other than that, there's no connection between having breast implants and having breast cancer. So the implant just gets behind the existing tissue and pushes it forward. So in some ways it can actually enhance finding lumps and bumps because the tissue is now on a platform.
Okay, so some people have heard different, stories about the dangers of getting a breast augmentation, but how dangerous is it?
Well, how high is up? That's a hard question to answer. The main risk, actually, of a breast augmentation is the anesthesia. The surgery itself is pretty low risk.